Am I audible and visible to you? Okay. So myself, Dr. Shital Pipaliya, your faculty for physiology. I did MD Physiology from MD Shah Medical College and I'm educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. NEET PG free test calendar is there for week 4. You can use code Shital10, attend different series, check with time and date. NEET PG 2022 All India mock test is there on 27th of March at 9 a.m. You can use the code Shital10 to enroll for the test. Let us go through some subscription details of Unacademy. With Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice and you can have access to the question bank having more than 25,000 questions in it. With the iconic subscription, you can have access to the best from two of the best. Unacademy and Prep Letter. With Unacademy, you will find various resources like well-structured live batches, recorded classes, question bank, and many more. Unacademy and Prep Letter. With the Prep Letter, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. So both are unique in its own way. Whatever is best suitable for you, that you can choose. These all are toppers of FMG December 2021. Congratulations to all the toppers from Unacademy. Special class feature are there now. Unacademy came up with some special class feature. Now classes will be highly interactive. There will be also a poll for the learner for their better understanding. You can raise a hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available. You can download it and you can even have access to the recorded sessions. You can attend the classes from any time, anywhere. There is a marathon batch for MCQ for NEET PG 2022. You can attend that. Duration is 2 months. High yield revision and MCQ batch is there. Duration is 2 months. So NEET PG subscription, Plus subscription, iconic subscription and light subscription are available with various duration and different prices. Now come to today's topic of cardiovascular system. Yesterday, previous class, I covered about the certain aspects of general principles of circulation, where you know now what is Wind-Kessel vessel, what is Wind-Kessel effect, what is resistance vessels, chief site of the resistance, and everything you know now. Now let us cover the other part of the general principle of circulation, that is capillaries. Okay, capillaries are exchange vessels. See, for arterioles and all, we use the word resistance vessels, like they are the one where resistance is offered, right? Wind-Kessel vessel is word used because these are the highly distensible vessels, right? So for capillaries, the word used is exchange vessels. Now, capillaries are consist of single layer of endothelial cells. Single layer of endothelial cell. Always remember, true capillaries do not have smooth muscle. No smooth muscle. Okay, true capillaries do not have smooth muscles. They are not controlled by any nervous or metabolic regulation. So who will decide how many number of capillaries will be open at a time? So that will be decided by opening of the precapillary sphincter. Okay, it is dependent on the number of the precapillary sphincter open at a time, which will decide number of open capillaries at a time. True capillaries do not have smooth muscle. They are not under control of nervous or any metabolic regulation. It is simply precapillary sphincter, number of precapillary sphincters open at a time, which will decide number of capillaries open at a time. Okay, so any change in the tone, of precapillary sphincter will determine the number of capillaries open, and therefore you can say it will decide the surface area. Okay, surface area available for the exchange of substances. See the word carefully here, exchange vessels, right? It means they are responsible for the exchange of substances. Okay, exchange of substances across the capillary wall, okay, between the blood and the interstitial fluid. So larger the area available, larger will be the exchange of the substances. See the diagram carefully. There are three types of capillary. One is continuous capillary, another one is fenestrated capillary, and discontinuous capillary. Total cross-sectional area of capillary bed, if they are fully open, then it is, you can say, 4,000 times more than that of aorta. Okay, it is 4,000 times than that of aorta. At rest, normally 25% of capillaries are open. At rest, about 25% of the capillaries are open. If all capillaries open fully, it will become, the area will become, total cross-sectional area will become 4,000 times more than the cross-sectional area of aorta. Okay, so you can see the types of the capillaries. Let us go through the first one, that is continuous capillary. See, continuous, or you can say they are non-fenestrated, right? They are non-fenestrated capillaries. So here there is a single layer. See this one, there is a single layer of the endothelial lining. Single layer of the endothelial lining, which is almost, you can say, continuous, except at these intercellular regions. So here this gap is approximately 4 to 10 nanometer wide. This is 4 to 10 nanometer wide. So it will allow the exchange of the fluid. Okay, exchange of the fluid and lipid soluble substances. It will allow exchange of fluid and lipid soluble substances between blood and interstitial fluid. Okay, this will go by the process of simple diffusion. Okay, simple diffusion means simple downhill movement. Diffusion is a downhill movement. So it will go by simple diffusion. Most of the body capillaries are this variety, continuous, or you can say non-fenestrated capillaries. Majority of the varieties are continuous, or you can say non-fenestrated varieties. Now let us go through the second variety, that is fenestrated capillaries. See, fenestrations, or you can say there are pores. Okay, there are pores which are approximately 20 to 100 nanometer wide. Okay, 20 to 100 nanometer in diameter. See this, there are, you can see these pores, right? So it allows the large escape of fluid. Okay, it can allow the large escape of fluid, and it is rapid also. The reason behind that is the number of the pores, okay, and they are wide. So large amount of substances can be exchanged, and the exchange is very rapid. Okay, so that is about the fenestrated capillaries. Then discontinuous, you can say, or sinusoids. You can say sinusoids. Discontinuous capillary or sinusoids. These capillaries, see this one, these capillaries possess very thin endothelial layer, very thin thin endothelial layer is there, and there is a large gap between individual cells. There is a large gap. Okay, so it allows quick and easy exchange of substances larger in size, like large protein. Easily it can be exchanged. Okay, large molecules, red blood cells can easily cross through it. Okay, so this is about discontinuous capillary, or you can say sinusoids. Continuous capillary, or you can say majority sites where you will find continuous or non-fenestrated capillaries, the site is skin, muscles, lungs, central nervous system. All these sites you will find continuous capillary. Fenestrated capillaries you will find in exocrine glands, renal glomerulus, intestinal mucosa. Here you will find fenestrated capillaries. Discontinuous or sinusoids, okay, this you will find in liver, spleen, bone marrow, anterior pituitary, adrenal gland. So these are the sites where you will find sinusoids. So these capillaries are important for trans-capillary exchange. Okay, across the cell wall, consider this as a cell wall of the capillary. This is blood and this is interstitium. So substances will pass, or you can say it will be exchanged by the process of filtration and absorption. So filtration and absorption across two ends of the capillaries, arterial end and venous end. Okay, where filtration and absorption of the fluid will occur, right? So it maintains blood volume. Okay, you know this. In these previous classes we discussed, right? At the arteriolar end and at the venous end there is a filtration of the fluid, and at the venous end there is absorption, right? So it maintains the blood volume. Then second important mechanism is diffusion, and by micropinocytosis, which allows the exchange of the macromolecules, those molecules which cannot cross the cell wall by filtration and absorption process, or by the process of diffusion. These all macromolecules will cross transport across the cell membrane by the process of micropinocytosis. So rest of the things I already covered in capillary circulation. So just remember this, that transcapillary exchange, three important mechanism are, first one is filtration and absorption, क्या करेगा, blood volume को maintain करेगा. Second, diffusion, and third one micropinocytosis. Micropinocytosis किस चीज के लिए चाहिए, macromolecules को transfer करने के लिए चाहिए. Okay. So post capillary venues are, you can say, they are the most permeable part of the microcirculation. Now come to the next one, that is capacitance vessel. Understand the word carefully. Capacitance vessels. So those vessels which have a capacity, you can say, right? So these are the vessels which are highly collapsible. Okay. So we can say veins. Veins are capacitance vessels. See, this year previous class I covered that veins are having very thin coat, right? Thin muscle coat. Smooth muscle layer is very thin in veins as compared to arteries. So they are collapsible. Okay. So simply by changing the shape from the circular, okay, to the elliptical, okay, it can accommodate, it will change the amount of blood volume available in the circulation. Okay, simply oval shape, okay, if it will change the shape from circular to elliptical, then also it can change the amount of blood volume available at a time in circulation. So you can see here that it will change the transmural pressure. Okay, it will change the transmural pressures. So these veins are having higher capacity. Whenever it will change the shape to circular, okay, it can adjust the blood into it, right? So they are capacitance vessel. मतलब कि वो adjust करेगा blood volume को, and it will reduce the amount of blood volume available in the circulation. क्योंकि blood volume जो है वो capacitance vessels में accommodate हो गया है. Okay, if it will change the shape from circular into elliptical, okay, it means it will release large amount of blood into the circulation, so it will increase the blood volume available in the circulation. Okay, so simply by changing the shape, it can change the amount of blood volume in the circulation. Now, two words you are supposed to understand is central venous pressure and peripheral venous pressure. See the word carefully. Central venous pressure, right? It means blood from systemic veins which flows into right atrium, right? So from the systemic circulation via inferior vena cava and via superior vena cava, blood will return to the right atrium, right? So right atrial pressure, this is important from MCQ point of view. Right atrial pressure will be considered as central venous pressure. Okay, it will be considered as central venous pressure, and normal value is approximately 4 to 6 mmHg. This is very important. Central venous pressure, right atrial pressure will be considered. Okay, and normal value is 4 to 6 mmHg. Then another one is peripheral venous pressure. Understand the word carefully. Peripheral venous pressure. Here, large veins, see, large veins offer considerable resistance to the flow. Why? That is because they remain compressed. Okay, they, because it passes through the systemic circulation, right? So in the system, in the peripheral parts of the body, at many points it will get compressed, right? ये compressed होती है. So because by the compression at many points in the surrounding tissue, peripheral venous pressure, you can say normally it is approximately 10 mmHg. Okay, pressure of the larger veins in the peripheral compartments of the body, that is considered as a peripheral venous pressure, and normal value is approximately 10 millimeter of mercury. Central venous pressure कितना है? Right atrial pressure जितना, मतलब कि 4 to 6 mmHg. ओके, एंड पेरिफेरल वेनस प्रेशर कितना है? जितना पेरिफेरल वेन्स में होना चाहिए, राइट? सो समवेयर नियर 10 millimeter of mercury. Okay, so that is about the venous pressure. Now come to the next one, that is shunt vessels. Okay, see the word shunt vessels, or you can say through-fare vessels. These vessels will bypass the capillaries. Okay, shunt, they will act like a shunt. Okay, so they will bypass capillaries and it will connect directly meta-arterioles with venules. Okay, it will connect the meta-arterioles with venules. So these are these shunt vessels are present at many sites like skin, toes, legs, fingers, palm, earlobes, lips, etc. Okay, so the importance of these shunt vessels is it helps in maintaining temperature of the body, because they are bypassing the capillaries and they are connecting meta-arterioles with the venules. Okay, they are connecting meta-arterioles with the venules. So this will help in maintaining the body temperature. Whenever the person get exposed to the cold environment, or when the person get exposed to the hot environment, okay, at that time either the shunt vessel will contract or it will relax, and it will change the blood flow to the surface area of the body. Okay, and depend on the type of the exposure to the environmental temperature, it will change the blood flow, and either it will increase heat loss or it will reduce heat loss. Okay, whenever it reduces the surface circulation, okay, at that time what it will do is it is minimizing the heat loss. If it promotes more and more blood flow towards the surface area of the body, means it is promoting the heat loss. So shunt vessels are the one which helps in maintaining the temperature. It helps in maintaining body temperature. So Two terms I want you to understand is vasculogenesis and angiogenesis. Vasculogenesis, this is important from MCQ point of view. Vasculogenesis and angiogenesis. Okay, so what is vasculogenesis? Vasculogenesis means during embryonic development, blood vessels are developed. Okay, blood vessels are developed. That is called as a vasculogenesis. These blood vessels are developed from where? They are developed from angioblasts. Okay, they are developed from the angioblast, and that is called as a vasculogenesis. Angiogenesis means that newer blood vessels are formed, but these blood vessels are formed from existing blood vessels. Okay, they are formed from existing blood vessels. That is called as angiogenesis. Means newer blood vessels are formed from budding. It is formed by budding from existing blood vessels. Okay, like let's take an example, like if the person is having development of the newer blood vessels in heart. Okay, anastomosis, newer development of the anastomosis. So in that case, what will happen? Consider this as a blood vessel and this one as a blood vessel. So here what will happen? First, there will be dissolution of the basement membrane, and the tube lined by the endothelial cells will start budding. Okay, from the site where there is a dissolution of the basement membrane. Same way on the other side also it will happen. And both the cord, the developing of the newer cord will move towards each other. Okay, and it will finally join and form the newer connection. Okay, so that is angiogenesis, means formation of the newer blood vessels by budding from the existing blood vessels. Okay, that is called as angiogenesis. So this is all about rest of the part of the general principles of circulation. So if you have any question, you can ask. If you have any question, you can ask. Okay, so subscribe Unacademy Future Doctors channel and help us to reach to more and more number of students. Thank you so much.